Module 3. Identifying transportation services in your community. In this module, we will address the next task a mobility manager may be asked to complete: developing an inventory of all available transportation services in the community. This module will answer questions such as, where do I find existing inventories of transportation services? How can I find information on additional services to add to these lists? And what type of information should I include in an inventory of services? In the module, An Introduction to Community Transportation, you were introduced to the many types of services that may make up a community's transportation network. You were also asked to begin listing all of the services you know in your area. In this module, we will take a look at more formal listings, or inventories of transportation services that will form the beginning of a comprehensive database of services. We will also discuss strategies for discovering additional services. Finally, we will review the Transportation Provider Profile Form, a tool that will help you gather characteristics about all public and private services available in your community. Once compiled, this information can be fed into a database, which will serve as one of your most valuable repositories of information that can be shared with the community. As you went through the module An Introduction to Community Transportation, how many of these different types of transportation services did you identify for your community? Remember, the family of services can include a wide breadth of services, such as bus and van services, shuttles, shared ride services such as carpools and van pools, ferries, volunteer services, bicycle and pedestrian options, and shared cars and bicycles. So how do you go about gathering data on all these types of services? Fortunately, there may be some organizations within your community that have already begun to create this list or inventory of services. Let's look at where you would find those. The first place to check for an inventory of transportation services is with your Metropolitan Planning Organization, Rural Planning Organization, Local Economic Development Organization, or Local Council of Government. Since October 2007, communities were required to develop such a list before they could apply for certain types of federal transportation funding. These organizations may also have an inventory of services that was pulled together as part of a study of transportation needs in your community. Also, contact these types of organizations to see if they have gathered such a list of services. State Departments of Transportation, particularly the office in charge of administering transportation grants, a local transportation management association, usually made up of local businesses and transportation professionals, a tourism agency or convention or visitors bureau, the agency in charge of emergency evacuations, which sometimes maintains a list of registered vehicles that could help in the case of an evacuation. Use your initial interaction with these agencies and organizations as a time to also begin building a relationship with them. Some of these may become important partners in future efforts to coordinate transportation and develop new services. These local inventories of transportation services should cover all the available publicly funded transportation services in an area. However, you may find that they do not include all services provided by local government agencies or private providers. Some of their information may already be in the inventory, but maybe not all. So what other types of services should be added to the inventory? First, let's look at other types of public agency-sponsored services. Sometimes the local area agency on aging, or council on aging, the Department of Social Services, the Department of Mental Health Services, or a workforce development agency will run a van or shuttle between the agency and common destinations for their clients. Most local school districts provide transportation for their students and should be included in the inventory. And don't forget about agencies and organizations that coordinate community efforts in emergency evacuation situations. Contact all of these groups in your community to see if they provide transportation services. Also, ask your contact at these agencies if they are aware of private providers or volunteer driver programs or other transportation resources that you should include in your inventory. Second, think about all of the private providers of transportation in your community. Faith-based organizations, such as local churches, temples, or mosques, or community-based organizations, such as community action agencies or the local YMCA, may have created a volunteer driver program. They may also run vans or shuttles with their own vehicles. The same may be true for local advocacy organizations, such as United Cerebral Palsy, or a local association serving individuals with a visual impairment, or others. A word about these types of private providers. Each of them may say any vans or shuttles they operate are for their clients only. However, chances are their vehicles sit idle in their parking lots for significant parts of the day. Once you have built a relationship with these programs, you might encourage them to consider sharing the insurance, costs, maintenance, and purchase costs of these vans or other vehicles with other organizations. Several communities have done this successfully. We'll talk more about how to begin coordination efforts in Module 9. Third, don't forget to talk with private taxi and chauffeur companies in your area. If there is a persistent need for repeated trips in your community, such as a patient who needs to travel to dialysis treatment 3 times a week, a taxi company may be willing to contract for services at a cost lower than that for individual trips. You might be able to do the same thing with private medical transportation providers who often can accommodate patients' needs for wheelchair-accessible or stretcher transportation in non-emergency situations. Other providers that should be listed in your database include private van pool companies, public and private ferry services or water taxis if you live near a major body of water, airport shuttles, and university or community college services. Carpool matching services are also a valuable type of community transportation support. Transportation management associations, councils of government, and metropolitan planning organizations are often the ones that do this. And finally, don't forget to think of employers. Some provide shuttle services to their premises for their employees, such as business parks, medical centers, assisted living centers, and large employers. So where do you find information on these and other types of services? Web and phone-based research are probably the first step for doing so. You could also look at any ride guides available in your community. And here's a thought. Look for help with this project from the research experts in your community, such as librarians. A good source of cheap and often free research labor is students enrolled in related programs in your local university or community college. Often college and sometimes even senior high school students are interested in volunteering for community service projects and can help with phone calls and web searches. Another technique is to ask riders at community destinations about transportation options. When you are providing outreach to the public about transportation issues, ask them about transportation services they know about. That is how one mobility manager learned about a service that picks up residents at local grocery stores and brings them home. This service was not on anyone's inventory before one person mentioned it to them. Here are some potential community destinations where you can ask or survey the locals about services they know about. Senior, youth, or community centers, libraries and public agencies, medical facilities such as hospital centers and clinics. Talk to patient discharge staff about transportation providers that serve the medical facilities, even shopping districts or malls. Also, survey sponsors and attendees at job, health, or senior services fairs to see if you can uncover names of additional transportation services. Contact supported work employment sites, such as Goodwill, Centers for Independent Living, and major employers to see if there are any additional transportation services. For example, an industrial site or an agricultural operation may provide shuttle service for its employees from their homes or a common pickup point. As you are gathering information about the services in your community, you will need to note all of the important details about how each of those services operates, who it serves, and how it determines eligibility. To assist you in doing that, use the Transportation Provider Profile form that is included in the Resources section for this module. You can fill out one of these for each provider in your community. If you are unfamiliar with some of the terms used on this form, review the module Introduction to Community Transportation to learn about them. The form has 6 sections. The first section asks for basic information about the transportation provider, such as address and contact information. The contact person you list could be the Director of Operations, the Paratransit Coordinator, the Director of Marketing, or a General Manager for smaller operations, whoever is knowledgeable about the provider's services. Note that the form asks whether the transportation provider is a member of the Better Business Bureau, the local Chamber of Commerce, and/or a professional membership organization for transportation providers, such as the Community Transportation Association of America, the American Public Transportation Association, or the Taxi, Limousine, and Paratransit Association. This type of information will help you determine if the provider is in good standing with the local business community as well as within its industry. Many of the membership organizations noted here will also provide ongoing education and even disseminate standards of conduct for its members. A positive response on these questions will give you a greater confidence in the quality of the service and help you determine if it is appropriate for your customers. It is also important to know if the organization receives federal or local funding, as this will determine whether they need to comply with standards for their drivers, such as drug and safety testing, and their service, such as providing ADA-compliant services. However, it is hoped any organization will meet these standards regardless of its funding source. This part of the form also asks where the public can access information about the provider's services, such as through published schedules or ride guides, on the Internet, or through a recorded information number or call center. It also notes where schedule information is updated during inclement weather or emergencies. Section 2 addresses service characteristics, such as time and day of service and the service area, and whether the service provides complementary service to people with disabilities in accordance with the Americans with Disabilities Act guidelines. Also in this section are questions about the fare, if any, the forms of payment accepted, types of routes and schedules, the types of locations where the provider picks up and drops off, such as medical facilities, grocery stores, adult daycare centers, etc., and, if applicable, the agency's reservations and cancellation policy. The third section asks questions about the type of vehicles, age of the vehicles, and features of the vehicles. Also note in this section information about insurance and other types of certifications, if available, such as whether the vehicle is Head Start compliant. The fourth section addresses driver qualifications, training, and testing, such as drug and alcohol testing. It also asks what languages are spoken by the provider's staff. The fifth section looks at the riders eligible to use the service, eligible trip purposes, and escort and service animal policies. The final section lists additional supports offered through the agency, such as different levels of instruction on how to use the provider's services, and anything else you might want to note about the provider. Once you have gathered all your information into a comprehensive database, Talk with your mobility management network partners regarding what information you will want to make public and what will be kept private, the most effective ways to share the information with the general public, human service agencies, businesses, medical centers, etc. This may be in paper or electronic form. Also think about how you will update the information. Please view the many resources and links to expand your learning beyond this module. Thank you for your participation.